Hello Epidemiology 4040 students. We will be covering material from Chapter 11 where we'll be talking about screening tests, the use of screening tests, and how they can be used to determine risk as well as outcome within the community. And we'll talk about the importance of them. We've already covered a little bit about screening tests in the class already when we talk about it from a primary and secondary and tertiary prevention method. And so think about the study designs that we've covered so far, and when would a screening test be appropriate within those study designs, as well as an epidemiologist, if you're looking at determining outbreaks or you're looking at populations that may be at high risk. Screening tests are used often to look and understand what might be going on within the population. A lot of you use screening tests within personally. For example, hello Public Health 4040 students. We're going to be covering material in Chapter 11 where we'll be talking about screening tests, their use and when it's appropriate to look for risk factors as well as disease outcomes or being able to diagnose disease within a population on early onset. Think of it from the perspective of we have study designs that we've covered, be it with case control and with cohort studies. But we're also wanting to be able to, as an epidemiologist, look for potential risk factors within a community, as well as to be able to determine what is actually happening within the community. And you want to do it in a rapid and an efficient, inexpensive way. And this is where screening tests are often really, really of value. Many of you are familiar with these types of screening tests, and we're going to talk about when they're appropriate to use, how to use them, and how do you understand the data that can come from them, and how will that be different than potentially looking at the gold standard. For example, your pregnancy tests, and how is that different than if you were to go into the clinic and have your blood drawn? Or when you go and donate blood, they do a quick screening test to determine your levels of iron within your blood. Or for example, if you have type 2 diabetes, you don't have to go into the doctor every day to be able to determine your sugar levels for your blood, where you can do a rapid screening test to determine that. Now, how accurate is that? We're going to cover that. And there's other tests that are also available. For example, if you're looking at different infectious diseases to do a rapid test such as that. Physicians use screening tests also all the time. For example, when you go in and it's like you have potentially are infected with strep throat, you have a rapid screening test that's done prior to the gold standard. It's important to understand what screening for disease actually means, and this is the presumptive identification of an unrecognized disease or defects by application of tests, examinations, or other procedures. This is always done prior to actually then confirming actual disease. You want to be able to do it in a rapid way where you can go into the community or go into the high-risk group and be able to then determine that to where they can then receive follow-up treatment as a result or confirmation of that. It's not always a laboratory-based test. It's important to remember that. There are screening tests that are out there that are survey-based or other types of informational type exams that could be done where then follow-up can be completed within a mental health clinic or within a physician's clinic or within a public health type of a setting. For example, there's lots of screening tests that are out there. Infectious disease, we're comfortable with understanding that, as in you go in, you have a rapid screening test, or you take a urine sample, or you take a quick little blood draw, or you take a swab within the throat, and at that point they can run it through that rapid test to determine positive or negative. With behavioral, it's not always necessary from a screening standpoint that ADHD or autism or other mental health issues are completed first by one that has the necessary credentials or a degree. Are there surveys that can be done or little tests that can be done to determine are you at higher risk for having these behavioral health issues? With chronic diseases, This is one where many of you are familiar with. For example, a quick and rapid cholesterol test. What is the screening test for breast cancer? I want you to think about that. Many of you know that answer already. For cervical test, what is the screening test for that? Be it the pap smear. Or prostate test, are you going to receive the PSA or the rectal exam? Or with colon cancer, how is that determined for a screening test? With health promotion, as I said just a second ago, with pregnancy tests, is there a different way than going and just doing a rapid test? Yeah, the blood test, that's done after that to confirm pregnancy. And then with high blood pressure, many of you guys have gone into like Walmart or into Walgreens and have sat down at those little electronic blood pressure monitoring cuffs and put your arm in that. That's an example of a screening test that's out there. Now, when you think about screening tests, you have to think about it as in when would these be done, and why would they be done, and how would they be done? There's different approaches that are done, and for example, there's multiphasic screening, and this is where you actually are going to implement more than one screening test together among a large group of individuals. And this is where you're trying to determine some baseline risk factors, the data, history of health, as well as other health measurements. For example, when I was first employed with the Idaho National Laboratory up in Idaho Falls, one of my first days there, they did a half day almost where I had this mass number of screening tests that were performed, be it through, I had hearing tests done, I had lung function tests done, I had my eyes checked, that's a screening test, I had blood drawn, I had some x-rays, and so they were trying to build and determine a baseline reading as to what I was coming in with from a health standpoint. They were also looking for potential health risk factors or potential disease states that I might have. And then from that, they ended up following me year after year, where I had some of these tests performed to determine whether or not there was an impact that was occurring with the workplace setting. Then there's also another way to look at it with mass screening. This is where you screen a large number or large scale of the total population groups regardless of risk status. And this is just trying to understand what's going on within the community. Or do we have a potential risk factor or a disease within a community that we're not all that aware of? For example, we could look at lung function or asthma rates within the community, and is there a rapid screening test that could be performed here in Cache County to determine the potential risk factors that may be associated with our air quality? And then there's the selective screening methods where you're actually just going and doing a subset of the population that may be at high risk for disease. Now, this is much more economical because you've now honed in on a population that you believe may be more at risk for developing this disease outcome. And you're not just testing everybody. For example, Tay-Sachs disease is an autosomal recessive genetic disorder or disease where it can cause long-term health consequences as a result in these individuals that are high risk. There is a gene that's associated with this particular disease that one can go and test for if individuals have a specific mutation. There are known populations, certain Jewish populations, as well as individuals that live in the Quebec area, as well as individuals that live in Louisiana that are known. There's data demonstrating that the individuals are at more high risk, or the genetics that are associated with those individuals that live in those regions or within that particular religion, where those genes have been passed from parents to offspring through multiple generations. And so you can go and do these selective screening type tests to determine whether or not these individuals will most likely develop the disease later in life. Another selective screening process that one can look at is testing the blood supply. You think about how individuals go in and donate blood, and there are specific selective tests that are done within those that donate to determine whether or not there is whether there are certain viruses or infectious diseases within that. So that is a selective type of a treatment. But then you ask the question, is there a way that you could actually do screening of the blood supply where a mass selection or where mass screening would occur? And the answer is yes too, where you could, if you have more data that's available on a specific disease or a risk factor, you can go in with permissions, of course, to be able to test the blood supply in order to look at to see if there is that potential for higher risk of developing disease.